you're 20 years old, you're in hospital, you're on a psychiatric ward, and you've been there for 3 years, since you were 17. You're not on any medication, and your medical records describe you as catatonic. In fact, you're so closed down to the outside world that you can't open your eyes. So you shuffle around with your eyes closed and bump into things. Now here's the interesting bit. Your psychiatrist is also a psychotherapist. And every day for the last 3 years, Monday to Friday, you've had a 50-minute session with him. Very often, for months on end actually, you've sat in silence and barely said a word. And often he doesn't say much either. But he has a sense that something very important is happening. Because not once have you missed an appointment, or even been late for one. Now this is a true story. This is an inspiring woman. This is Cathy Penney today. Now, and her doctor, which is the next slide, he must be quite something too, actually, because his name is Daniel Dorman, and he refused to prescribe medication. He felt that it would not help her healing, that if anything it would hinder, and that she wouldn't be able to access that healthy inner core of her being, which was buried very deeply in her case. He really had to stand his ground on against his colleagues. He was accused of misconduct, of not doing his duty, of relieving her suffering. Now his misconduct led to Cathy being able to completely turn her life around. Okay, over a long period of time, because in total she was in hospital for about 7 years and had therapy for that period of time. But she went through a complete metamorphosis and went on to live a very rich and full and totally independent life. And on top of that, she went into the mental health field and trained as a mental health nurse, and more latterly, as she's come towards the end of her career, she's trained and supervised mental health nurses. And what an incredible nurse and trainer and supervisor she must be. Cathy has very kindly written the foreword to my new book. I approached her because I felt that more than any other person I had come across, she embodied the message of this new book, which is that crisis can be the catalyst for healing, that every mental health crisis holds the potential for healing and growth.